Angina pectoris is a symptom of ischemic heart disease. Types of angina pectoris: stable angina or classical angina, unstable angina, Prince metal angina or variant angina. Stable angina or classical angina is characterized by episodes of chest pain commonly associated with exertion. Stable angina or classical angina is associated with episodes of chest pain commonly associated with exertion. Unstable angina. It is characterized by angina at rest and increased frequency and duration of the anginal attack. Unstable angina is characterized by angina at rest and increased frequency and duration of anginal attack. In most cases, it is commonly due to rupture of atheromatous plaque and platelet deposition in the coronary artery, leading to progressive thrombosis. In most cases में unstable angina is due to rupture of atheromatous plaque and platelet deposition in the coronary artery, leading to progressive thrombosis. In most cases, unstable angina is due to rupture of atheromatous plaque and platelet deposition in the coronary artery, leading to progressive thrombosis. Prince metal angina or variant angina. Angina that occurs at rest and is due to spasm of coronary arteries. Unstable angina, it is because of progressive thrombosis. It is because of the rupture of atheromatous plaque and platelet deposition. And Prince metal angina or variant angina, it is the angina that occurs at rest and it is due to spasm of coronary arteries. Stable angina is the angina associated with exertion. Unstable angina at rest due to the rupture of atheromatous plaque and platelet deposition. Prince metal angina or variant angina, the angina that occurs at rest due to the spasm of coronary arteries. Pathophysiology of angina. Angina occurs due to imbalance in oxygen supply and oxygen demand by the myocardium. It is due to imbalance in the oxygen supply and oxygen demand of the myocardium. Okay. Decreased oxygen supply can be due to coronary atherosclerosis, coronary vasospasm, and coronary thrombosis. Decreased oxygen supply can be due to coronary atherosclerosis, coronary vasospasm, and coronary thrombosis. And decreased oxygen demand can be due to increase in heart rate, ventricular hypertrophy, increased ventricular contractility, increased ventricular wall tension. Increased oxygen demand could be due to increased heart rate, ventricular hypertrophy, increased ventricular contractility, or increased wall tension. Increased heart rate, increased ventricular contractility due to ventricular hypertrophy, and increased ventricular wall tension. Treatment is aimed at maintaining the balance between oxygen supply and demand. To increase oxygen supply, restore the coronary blood flow by percutaneous coronary intervention including stenting or coronary artery bypass graft. Relieve the vasospasm by drugs like calcium channel blockers and nitrates. Calcium channel blockers and nitrates will relieve the vasospasm. To break the thrombi, use thrombolytic agents like streptokinase, urokinase. Prevent thrombus formation by using antiplatelet drugs. ऑक्सीजन सप्लाई को इंक्रीज़ करने के लिए परक्यूटेनियस इंटरवेंशन इंक्लूडिंग स्टेंटन, कोरोनरी आर्टरी बाईपास सर्जरी, कैल्शियम चैनल ब्लॉकर्स एंड नाइट्रेट्स विल रिलीव द वैसोस्पाज्म. थ्रोम्बाई को ब्रेक करने के लिए थ्रोम्बोलाइटिक एजेंट्स लाइक स्ट्रेप्टोकाइनेस, यूरोकाइनेस एंड एंटीप्लेटलेट ड्रग्स विल प्रिवेंट द थ्रोम्बस फॉर्मेशन. ऑक्सीजन डिमांड को डिक्रीज़ करने के लिए decrease the preload mainly by nitrates, decrease the afterload by CCBs and potassium channel openers. पोटाशियम चैनल ओपनर्स और CCBs के कारण आफ्टर लोड कम हो जाएगा, नाइट्रेट्स के कारण प्री लोड कम होगा, CCBs कैल्शियम चैनल ओपनर्स के कारण आफ्टर लोड कम होगा, बीटा ब्लॉकर्स के कारण हार्ट रेट और कॉन्ट्रैक्टिलिटी कम होगा, नाइट्रेट्स के कारण प्री लोड कम हो जाएगा, CCBs और पोटेशियम चैनल ओपनर्स के कारण आफ्टर लोड कम होगा, बीटा ब्लॉकर के कारण हार्ट रेट और कॉन्ट्रैक्टिलिटी कम होगा।